My name is Mike Pishvaian. I'm an associate professor in gastrointestinal oncology at Johns Hopkins University School of Medicine. So unfortunately, we know that GI cancers are some of the worst cancers that are out there, and cholangiocarcinomas are no exception. So we're always looking for other ways to treat these patients. And as oncologists, we're motivated, we're buoyed by the occasional patients who are truly exceptional responders. So in the world of cholangiocarcinoma, I've had a few different occasions of exceptional responders, and I was going to break it down by era. In the pre-molecular testing era, even the pre-gemcitabine cisplatin era, I actually first learned that there was a potential role in cholangiocarcinoma for patients to receive liver-directed therapy. I had an older woman who could not undertake systemic chemotherapy, but had liver-only disease, and our interventional radiologist treated her with radioembolization, these tiny radioactive beads that were inserted into the artery that feeds the liver. And she had excellent control over disease for more than a year without needing chemotherapy at all. And that motivated me to incorporate that kind of procedure in the appropriately selected cholangiocarcinoma patients. Then in the era of systemic chemotherapy, where gemcitabine cisplatin was a proven first-line regimen, we've had patients that have had excellent response to that combination. But I will say that the original study was done where the patients were treated 2 weeks in a row and then a 1 week break, what we call 2 on, 1 off for cholangiocarcinoma. And that can be a little taxing on patients if they're on treatment for a long time. There have been some retrospective reviews in cholangiocarcinoma that have shown that giving the gemcitabine cisplatin every other week is actually just as effective and much, much better tolerated. So once patients really get out into several months of treatment, then I usually switch to an every other week regimen. And I've had patients, thankfully, that have been able to be on treatment for 18, 24 months sometimes. And then certainly in the molecular era for cholangiocarcinoma, where up to 40% of cholangiocarcinomas harbor what we call so-called genetic actionable alterations for which there's a specific targeted therapy, we've all had the benefit of seeing some really exceptional responders when the right patient gets on the right therapy. So for example, a patient whose tumor has an FGFR2 fusion can have an exceptional response to an FGFR inhibitor. A patient with an NTRK fusion can have an exceptional response to a TRK inhibitor. So that's why it's really important for the oncology team to be sending genetic testing to look for these actionable alterations.